Ladies and gentlemen, thank you for standing by. Welcome to the Pricing for Health, How to Make the Unhealthy Stuff More Expensive and How to Make the Healthy Stuff Cheaper webinar. During the presentation, all participants will be in a listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded today, Thursday, June 23, 2011. I will now like to turn the conference over to Ms. Christine Fry. Please go ahead, madam.
Thank you. Good morning, everyone. I'm Christine Fry, and welcome to Pricing for Health, How to Make the Unhealthy Stuff More Expensive and How to Make the Healthy Stuff Cheaper. This webinar is produced by Public Health Law and Policy and NPLAN. We're based in Oakland, California, and it's sponsored by the Robert Wood Johnson Foundation's Childhood Obesity Initiative. If you're a longtime fan of PHLP webinars, you will notice that we are on a new platform, ReadyTalk, which we're really excited about, and we hope that it will provide you with a better webinar experience today. So briefly, this is me. I am a policy associate here at Public Health Law and Policy, and I will be facilitating this call and helping to moderate the questions and answers and transitions throughout the webinar. So just a brief note about technology. If you do have any trouble, which we hope you don't, with the web portion of the broadcast or hearing things through your speakers, just if you can get to the chat box on the lower left-hand side of your screen, you can type in your problem there, and the folks at ReadyTalk will take care of you. Or as the operator said at the beginning of the call, you can also press *0 on your phone if you're dialed in for any reason, and somebody can assist you there. Now, we are also going to be using the chat box to get your questions about the content of the webinar. So just to make sure that everybody knows how to use the chat box and that you're not shy about typing in that question during the course of the webinar, we want to warm it up for you. So just to make sure you guys are all hearing me and listening and paying attention here, type in to the chat box your favorite sports team. So go ahead. It doesn't matter what sport, but whoever your favorite team is. All right. So we're getting lots of answers here. Wow, we've got some sports fans on the line. So it looks like all of you do know how to use the chat box. And when you do have a question for any of the presenters, just type it in. You don't have to wait for the end of the presentation or anything like that. We'll be try to take questions between the presentations and at the end of the webinar. So there should be plenty of time to get to those. As it was mentioned at the beginning of the webinar, we are recording the webinar, and we will post the recording and slides on our website by tomorrow. So just a brief note about Public Health Law and Policy. If you aren't familiar with our work, we work with state and local leaders to improve health of all communities, particularly the underserved. And we do this by focusing on law and policy, researching legal and policy questions, drafting model policies, which you can find on our website, and doing trainings like this one for leaders around the country. And we work particularly on tobacco control, obesity prevention, and healthy planning. A quick disclaimer, because I work with a lot of lawyers, I have to have some fine print here. The information in this webinar is for informational purposes only and is not legal advice. We don't enter into attorney-client relationships. And then also we incorporate objective, nonpartisan analysis, study, and research into all of our work. And this presentation does not present views on any specific legislation. So a quick note about our plan for today. I'm going to kick things off with our content and talk a little bit about how price influences people's behavior. just to frame the content of the webinar. And then we will hear from Ian McLaughlin and the folks from Seattle King County, who will be talking about different strategies to make the unhealthy stuff or unhealthy food more expensive. And then we'll hear from Heather Wooten and Melissa from First Health talking about strategies to make healthy foods less expensive. And then we'll have more time for question and answers at the end of the session. So now let's think a little bit about how price affects people's behavior. Prices change over time. Price of food and other products change over time for many different reasons. Market forces are certainly one big reason. The availability of a product and technological advances, for example, can affect price. For example, we can now eat strawberries year-round and for relatively low cost because food can be kept fresh while being shipped around the globe. So we're not as dependent on seasons in the U.S. in order to get fresh fruits and vegetables at any time of the year. But public policy also has an influence on price. And today's session will focus mostly on policy strategies for lowering the price of healthy foods and perhaps raising the price, or at least helping to limit the availability of unhealthy foods. So over the past several decades, food has gotten less expensive overall. In general, when prices go down, people tend to buy more and consume more of a product. And in fact, in looking at food in particular, the USDA estimates that the average American eats about 25% more calories today than they did in 1970. But not all food prices have uniformly gone down. For example, over the past 15 years, produce prices have gone up by 38%, while soft drink prices, by contrast, have gone down 23%. In general, when price goes up or incomes go down, people buy less of a product. Economists call this relationship between price and demand the elasticity of demand. Not all products have equal elasticity. The classic example of this concept is if you think about a luxury yacht. That's considered a product that has a high elasticity of demand. And you can think about why. It's the sales of luxury yachts go down as incomes decrease because they're not a necessity to life. It's something you can cut back on when the price goes up for the luxury yacht or when your income is more limited. In general, demand for food is somewhat inelastic. And food is a basic necessity of life, so people need to buy it no matter what the price. But if you break food down into different categories like fresh fruit, soda, packaged foods, you start to see differences in how people's behavior changes in response to price. This is good news for those of us who care about health. For example, it turns out that demand for sugar-sweetened beverages is somewhat elastic. Economists estimate that a 10% increase in the price of sugar-sweetened beverages would lead to about an 8 to 10% decrease in the amount of calories that people consume from sugar-sweetened beverages. So this means that there's a really good chance that policies that aim to increase the price of unhealthy foods like sugar-sweetened beverages could affect people's behavior and ultimately lead to improved health. Thinking about another trend that affects what people eat is that low-cost, energy-dense foods have become more convenient. Any guesses as to what this map represents? These little pinpoints. So if you haven't seen this map before, it shows the distribution of McDonald's restaurants in the United States. So every little pinpoint of light is a McDonald's. And as you can see, they seem to be everywhere. And it's not just about fast food restaurants or McDonald's. We now are surrounded by food, and often unhealthy food, at rest stops on the highway and airports in our offices, in schools, and at the mall. Everywhere you go, food marketers have figured out a way to offer you convenient food. And that certainly affects people's behavior. Now, when we talk about price, we pay special attention to the ability of low-income households to purchase a healthy diet. And we have here on the screen, do the poor pay more? And on the average, the answer is yes. Low-income households may face higher food prices for 3 reasons. 1, on average, low-income households may spend less money or shop less in supermarkets, which tend to offer the lowest prices and the greatest range of brands, package sizes, and quality choices, as compared to other types of food retailers. The second reason is that low-income households are less likely to live in suburban locations where food prices are typically lower. And then finally, supermarkets in low-income neighborhoods may charge higher prices than those in higher-income neighborhoods. So how do low-income families make it work? Typically, a strategy that they use is by buying cheaper products and lower quality items. However, in areas where food choices are very limited due to the kinds and locations of food stores, even cheap food may not be available, and households may have sharply higher food costs, which can result in hunger and food insecurity for these families. So what we're going to talk about today are state and local food policy tools to help make healthy food less expensive. I'm going to do a brief overview of some of the strategies that we'll cover today before turning this over to our next presenter. So state and local taxes are one way that we can think about increasing the price of unhealthy food. One example are the so-called sugar-sweetened beverage taxes, or fees, which can not only be a way to raise the price of these products, but can also raise revenue for obesity prevention programs. Reducing the amount of sugar-sweetened beverages consumed is an important element of an overall strategy to reducing childhood obesity, and several states and a few localities over the past couple of years have considered sugar-sweetened beverage taxes as an obesity prevention strategy. PHLP has done a lot of work in this area, and we will be hearing actually from some of our partners in that work, Jim and Ann from Seattle-King County, who will talk a little bit more about this strategy. Another tool is land use planning, which you might think, well, that doesn't really seem like something that has to do with price. But where things are located can make it easier or more difficult to access certain types of food retailers. Through comprehensive plans and zoning, local governments make decisions about what kinds of uses are permitted where. Many communities already use zoning to limit where fast food restaurants can be located. By making it more difficult to access unhealthy food purveyors, like fast food restaurants, you can effectively increase the cost of that food. If it takes longer to get to a fast food restaurant, then you're wasting time, and as they say, time is money. But zoning isn't the only way to get rid of unhealthy food. Zoning can also be used to offer incentives to healthy food retailers. For example, the City of New York reduces the amount of required parking for grocery stores that open in underserved areas. These incentives can have a downstream impact on cost in 2 ways. They can decrease the cost of doing business for healthy food retailers, which can then hopefully trickle down to the pricing of their products, and it can lower the barriers to developing new healthy food retail, which will put these stores closer to people who live in areas that don't have many options for healthy food. And again, as we say, time is money. If you're closer to healthy food, it effectively lowers the cost of it. Another tool, which we're not going to cover as much in this presentation as we might if we had more time, but I want to mention it, is transportation policy. People without access to a car or adequate public transportation have a hard time getting to places that sell affordable, quality foods. For those who do make the trip, the cost of taxis or bus fare can decrease the amount that they're actually able to spend on groceries. Local governments can work with transit authorities to reroute buses and connect underserved neighborhoods to large supermarkets. And they can also incentivize supermarket developers to locate near existing public transit routes. Economic development is another tool in the local government toolbox. This refers to the range of activities that help build and sustain a healthy economy, which generally includes things like attracting businesses like new grocery stores to neighborhoods, providing funds for facade improvements for corner stores to make them more attractive places to shop, and then workforce development to help local residents take advantage of new jobs that are offered by potential new healthy food retailers. We really encourage public health advocates and officials to reach out to economic development agencies and look for ways to collaborate on healthy food retail projects. This is just another strategy that will be touched upon throughout today's presentations. Finally, procurement. It's essentially, by procurement, we mean all of the goods and services that both government and other large institutions purchase. For instance, government buys office supplies. It pays local hospitals to provide health care. It buys a lot of food, which is available in a variety of settings like parks, schools, public hospitals, jails. And procurement policy extends not just to food that's directly offered by a government agency, but government agencies also contract with food service providers like concession stand operators or vending machine operators. For the most part, agencies and institutions have a lot of say over the goods and services that they purchase. So it's really up to them and to all of you to think about ways that healthier foods can be made more affordable and more accessible through procurement policy. And this is another topic that Heather and Melissa will talk about towards the end of today's session. So that's just a quick overview of some of the different strategies that you'll hear about on today's webinar. And now I'm going to turn things over to Ian McLaughlin, who is a senior staff attorney here at PHLP, and he's going to talk about some policy strategies to increase the price of unhealthy food. Ian?
Thanks, Christine, and good morning, good afternoon, everyone. I am going to be talking a little bit more specifically now about some of the policy strategies that are available to increase the price of unhealthy foods. And obviously this is a politically charged issue because we're talking about basically making more expensive the things that people eat and drink. And so there's a lot of industry opposition, and this is politically charged in many ways, as those of you who have been working on tax campaigns know well. I'm not really going to be talking so much about industry opposition and some of the political issues, but I'm just going to be giving an overview of just a few of the strategies that can be used to increase the price of unhealthy foods. So what policy options are available? I'm going to be talking about 5 today, and basically, before I talk about any of these, we really are talking about taxes on the one hand and everything else on the other hand, because to date, taxes have been the most prevalently used strategy to increase the price of anything for public health reasons, starting with tobacco and alcohol and now being imported into the food arena. But I'm going to be talking about taxes and fees, and a close relative of taxes and fees, that's tax incentives. And I refer to those as indirect policies because although taxes and tax incentives do have an effect on the price of goods that are sold at retail, they're not policies by which the government says, this is the price you must sell something at. Those are more on the bottom 3 policies I'm going to be talking about: minimum price laws, policies to counter retail price manipulation like discounts and coupons, and then how you can control the price of goods sold on government property. Those are more direct policies, or what I refer to as direct policies, because they are policies through which the government says you have to sell a good at this price, or you have to sell it not less than this price. So that's the 5 things I'm going to talk about for about the next 10 minutes. And this is by no means an exhaustive universe of the pricing strategies that are available, but I chose these 5 for today because either they have been used successfully in tobacco control, or they are policies that hold a lot of promise and we have been looking into further here at PHLP. So let's start with taxes. Everybody is familiar with taxes for better or for worse. We are taxed in a lot of areas in our life, and the power to tax is one of government's most fundamental powers. States have relatively broad authority to tax, subject really only to the Constitution. And cities and counties and other municipal political subdivisions of states have less authority than the states do, and they are really limited to the authority to tax that's granted from the state to the cities and counties. Now, I think some of you have heard our presentations or heard other presentations that talk about the various types of taxes, and I'm going to talk about two here for a minute because they bear repeating, and that is sales taxes and excise taxes. Because if we want to use taxing as a pricing strategy, it's really important to choose the correct kinds of tax. So to start off with sales taxes, again, we're all familiar with what a sales tax is, I think, because every state, with just a couple of exceptions, imposes a sales tax. And a sales tax is imposed on consumers who purchase goods at retail, and it's almost always measured as a percentage of the overall sales price. So here on the left you see a sample receipt, and the lower circle shows the tax amount, in this case 6%, and the upper circle shows one item on the long list of receipt items that's subject to the tax. It has a T next to it. It happens to be duct tape. The rest of the items on the receipt are not subject to the tax. So sales taxes are really not a pricing strategy at all. They don't end up increasing the shelf price of any goods or services, and in fact, you don't even know that you're paying a sales tax sometime until you check out and you pay for the goods at the cash register. And even then, if you have a long list of items that you purchased on a receipt, you might still not know which items were subject to the tax or not. So since it doesn't increase the shelf price, sales taxes really are not a very good pricing strategy. However, they are a good strategy to raise revenue. So if that's one of your goals, raising revenue for the government, that's one way to do it. For pricing strategies, we really are talking about excise taxes. And we've heard a lot about excise taxes in the context of sugar-sweetened beverages. But excise taxes really are a broad range of taxes. It stands for a broad class of taxes imposed on businesses that sell tangible goods. They might go by many different names, business license taxes or gross receipts taxes or others. But basically, anytime we're talking about a tax on a business for selling a certain type of good, that generally is an excise tax. Excise taxes really have been the most common so-called sin taxes or product-specific taxes imposed to date on alcohol, gasoline, tobacco, and other items. And often they cause a visible price increase. Here's an example from tobacco. As I said, taxes have been a very good pricing strategy in the tobacco world, and we're trying to import that success into the obesity movement. Here's a rough outline about how cigarettes are priced. And you see the top two line items show the cost of production and the producer's profit. Now, that $5 is really taken out of thin air for purposes of illustration. But then below that, you see a variety of excise taxes imposed by the federal government or states or even localities that are added on to the price of cigarettes. And then all of that is subject to a sales tax as well. So if you start off with $5 for the cost of production and the profit margin, you might end up with $7.80 as the final shelf price of the cigarettes. So those excise taxes really caused a visible and significant price increase. And as Christine mentioned in her opening slides, the price increase, and especially for tobacco products, has led to a decrease in consumption. So that's really the key when we're talking about taxes, is that if you want to use taxing as a price strategy, it must increase the shelf price like it has in tobacco taxes. How can we ensure that that will happen? Well, as I just said, excise taxes are really much more effective than sales taxes, which don't work. And another thing that we've tried to take from tobacco is some states have tobacco tax laws that say this tax must be passed on to the consumer in the final purchase price. Now, that's not part of our model sugar-sweetened beverage tax legislation that we've put out at PHLP, but it's certainly something that you could explore in your own community to mandate that the excise tax on any good be passed on to the consumer. I want to mention one alternative to a tax very briefly, and that is a regulatory fee. That's not a tax at all, but a regulatory fee is also charged on businesses for the privilege of selling certain products. And the fee proceeds can only be used for regulatory programs that the government runs to mitigate the harm or otherwise regulate that product. A very good example that's relatively common are licensing fees for tobacco retailers. Almost every state and many municipalities have tobacco retailer licensing requirements, and many of them charge fees to the retailers to fund the license program. That's one example, but I think that regulatory fees have not been explored enough yet, and that they could be used as a pricing strategy or just as a way to fund regulatory programs for unhealthy foods in many different states. A close relative of taxes and fees is tax incentives, and tax incentives take on many forms: tax credits, exemptions, deductions. And I think that whether we realize it or not, they affect our everyday life. For example, the home mortgage interest deduction is a very common tax incentive offered by the federal government. Many states offer tax credits for installing solar panels on your house, that sort of thing. And it's a relatively common tool for the government to incentivize the behavior that it wants you to engage in. The power to grant a tax incentive is really the same as the power to tax. So to the extent that you have the power to levy a tax, then you have the power to grant a tax incentive. And I think that incentives really probably belong more in the second half of today's webinar, which is how do we get stores to offer affordable and healthy foods. But I put it here because I think that tax incentives could be used creatively really to incentivize all sorts of behaviors. For example, maybe it could be used to incentivize businesses to pass on an excise tax if that's what you want to do. So this is really something worth exploring as well. So moving on now, that's taxes and tax incentives. And I just want to touch briefly on the final three things I mentioned that have not been used as much yet in the obesity realm, but really bear some further exploration as well. And the first of those is minimum price laws. A minimum price law is essentially a law by the state that says if you sell this certain product, you have to sell it for this minimum price. And the price is usually not set as an exact dollar amount, but it's based on a formula that runs through the manufacturer's price and certain profit margins along the whole chain of distribution. If you've not heard of minimum price laws, that's not because they don't exist. As a matter of fact, about half the states have minimum price laws in place for tobacco and have for several decades. And they really are not uncommon for other products as well. If you start looking through your state laws, you'll notice that there are minimum price laws for a variety of things. For example, milk is a very common product that's been subject to minimum price laws in many states. I'm not aware of any minimum price laws that have been used for public health purposes. For the most part, they have been used to promote competition and to protect retailers from unfair competition. But again, we're exploring this further in the tobacco world to see if we could use minimum price more effectively in tobacco. And if you really want to use a pricing strategy for foods, this is one that also bears further work. The next thing I want to talk about, this slide says proportional pricing. And really, this is one strategy to counter retail price manipulation. Before I get into the slide, just some background information from our experience in tobacco. Tobacco companies really have very few avenues to advertise their products now. They can't do it on TV, they can't do it on radio, billboards. They don't have a lot of places left to spend their promotional dollars. So the latest figures that they reported to the FTC show that almost 90% of over $13 billion that the tobacco industry spends on promotional activities is spent at the point of sale to lower the price of the product. So I just showed you how excise taxes can increase the price of tobacco. Well, the tobacco industry is engaging in a lot of different tactics to actually lower that price, whether it's coupons, 2-for-1 offers, or other discounts. So they're really trying to get that price lower. And we have been wondering how we can, if those same kind of strategies would be useful in the obesity world. So to what extent are retail price manipulation tactics used for food? And we've identified a few, and I would like to hear from the field after the webinar or offline if you have identified any other retail price manipulation tactics used by the food or beverage industry. So now to turn back to the slide, here's one that we have identified, and that is proportional pricing. This is a movie theater price facade, and you'll see I've circled the fountain drinks. And I think everybody who's been to a movie is familiar with the cashier saying, would you like the extra large for a quarter more? Whereas the difference in the price between a medium and a small is 50 cents. So this is one example where you are being encouraged to purchase a larger size of something that contains a lot of sugar, in this case a fountain drink, for a lower price. The idea of proportional pricing is the government might be able to pass a policy that says whatever price you sell a drink for any ounce is the same price that you have to charge for every drink per ounce. So the large would no longer just be a quarter more. It would be proportionally higher based on how much you're charging per ounce. Here's one more example of proportional pricing that's very familiar as well. This is an ad for $1 for any size soft drink, and of course this encourages you to purchase the largest drink possible because economically it would make no sense not to do so. Again, if you had a policy on proportional pricing, then the large drink could not be the same price as the small drink. It would have to be proportionally priced higher. This is something that we're actually still in the midst of researching and developing some language on, so you can expect more to come on this in times to come. Another sort of tangential pricing strategy that relates to countering retail price manipulation is just to change how the product is sold. No free refills, for example, or limiting serving size could have an effect on price. And finally, the last thing I'll mention, you'll hear a little bit more about this during the last presentation, and that is a small subset of sales of food occur on government property, in vending machines, cafeteria, and through government concessions. And there are efforts underway for the government, in some governments, to control the price of goods sold on government property in vending machines and on concession stands. One project that's going on now in the state of Delaware could yield some really interesting information on how this might work. But in this case, the government is acting as a market participant and not just as a government. And so the government does have greater control over pricing of goods that are sold on government property. So with that, I'm a little bit over, so I'll end and turn it back to Christine. Thanks.
Thanks, Ian. And we're starting to get a bunch of questions, so thanks to everybody who's listening for not being shy and typing those questions into the chat box. Ian, briefly before we turn to the folks from Seattle-King County, one question that came in is what states and large municipalities have excise taxes on sugar-sweetened beverages in particular?
Well, so far there's just a few, and the few that have excise taxes on sugar-sweetened beverages have had them on the books for a number of years now. I think there's 8 states, and the city of Chicago is the only municipality that has anything on the books. But I think the real takeaway is that there is no meaningful excise tax yet that has been enacted on sugar-sweetened beverages. And we're still waiting to have one enacted so that we can see what the effect on consumer behavior will be. Because to date, like I said, the existing taxes are not very large and they have not actually had any effect on price.
Thanks, Ian. And one thing to note about that, if you're curious about those existing taxes that have been on the books for a while, there's a great article, which I'll post a link into the chat box, from the early 2000s by Kelly Brownell and Michael Jacobson that catalogs some of those existing taxes. So now we will turn it over to our friends from the Public Health Department at Seattle-King County. Jim Krieger is the Chief of the Chronic Disease and Injury Prevention Section at Public Health, Seattle-King County, and a clinical professor of medicine and health services at the University of Washington. He was a member of the Institute of Medicine's Committee on Childhood Obesity Action for Local Governments in 2008 and 2009, and he is the founding chair of the NACCHO Big Cities Chronic Disease Community of Practice, and he leads its sugar-sweetened beverage work group. We also have joining him Ann Pearson, who is also with the Public Health Department at Seattle-King County, and she's a member of their Communities Putting Prevention to Work team as a policy advisor. Prior to joining Public Health, she was the Senior Legal Counsel for Policy at the New York City Health Department's Bureau of Tobacco Control. Jim and Ann?
Yeah, hello everybody. This is Jim from Seattle, and it's great to be with you this morning or afternoon. And I appreciate my colleagues from PHLP for the great overview that they presented. What we're going to talk about today is pricing, and particularly taxing approach to sugary drinks. What we mean by sugary drinks goes beyond just the usual conception of soda, and it refers to all other kinds of drinks that have added sugar to them. For example, sports drinks, sweet teas, fruit drinks, energy drinks, even flavored waters. These are the latter type, other than soda, are actually accounting for an increasing share of the market and becoming more and more important as sources of added sugar in children's as well as adults' diets. So it's important to have a broad focus when we talk about sugary drinks. Sugary drinks have a lot of sugar in them. For example, the usual soda serving is about 20 ounces now, and that has 16 teaspoons or 16 packets of sugar. That is a lot of sugar. So why the focus on sugary drinks? They virtually have no nutritional value. The consumption is skyrocketing, and people are drinking almost 3 times as much as they did 30 years ago. And there are strong epidemiologic and clinical evidence linking them to a lot of serious health conditions, including obesity, diabetes, high blood pressure, heart disease, and tooth decay. In Seattle and King County and other places around the country, there have been several strategies that have been considered or implemented to reduce sugary drink consumption. One is education, and education examples might include posting websites with information about sugary drinks that people can be directed to. They can include media campaigns. There's an example of one that we'll be launching here soon in Seattle and King County, trying to call people's attention to the issues concerned with sugary drinks and recommending milk or water as alternatives. Another campaign is a pledge campaign that we have launched to encourage people to pledge not to drink any sugary drinks on Sundays, for example, and to see what they can do in their homes or their workplaces or schools to reduce the availability of those kind of products. Second strategy is to decrease availability, and so some of these strategies would relate to procurement, as Ian and others have already talked about, or decreasing the prominence of display of sugary drinks at supermarkets and other settings, or to have policies governing events, say at school events or at meetings where sugary drinks wouldn't be available. And finally, the focus of today is increasing price. And so we'll spend the rest of our time talking about that in more detail. And I'll turn it over to Ann now.
Thanks, Jim. I'm going to turn now to talk about how pricing can be used as a strategy to reduce consumption of sugary drinks. And pricing really is a strategy that's taken directly from tobacco control's playbook. So I want to say a couple words about how it's been used in that context. The evidence really is very clear that raising the price of tobacco is the most effective strategy to reduce consumption of tobacco products among adults, but also to prevent initiation of tobacco use among youth. The evidence shows that a 10% increase in the price of tobacco reduces consumption by 3 to 5% overall, so across all age groups, but by 6 to 7% among youth. And there really are few other interventions that I can think of that yield that type of reduction in consumption. The reason that price increases affect youth more than adults is that youth are more price sensitive, which is to say, since they have less pocket money at their disposal, they're less able to afford tobacco products when there is a price increase, and therefore more likely to reduce their consumption. And this is one reason that price strategies can be a really great choice when you're trying to impact consumption among youth or other populations that are price sensitive. Price strategies also have a couple other benefits as well. They have the potential to generate revenue that can be earmarked for different types of programs, and there are some states that have tobacco products and have earmarked the revenue there for comprehensive tobacco control. They also have the ability to send a message and affect the way we think about different products. When we impose a special tax on a product the way that we do with things like tobacco and alcohol and gasoline, we're really sending a message that the use of this product should be discouraged. So taxes have the ability to impact social norming as well. So when we move to thinking about how to apply price strategies to sugary drinks, there are a couple of questions to be asked and also a couple important things for us to keep in mind. Some of the key questions, which we're going to talk about in more detail, are what's the vehicle by which you increase the price? How will the price increase affect consumption, and what will you do with the revenue? And that's the fun part. But before we turn to those, there are a couple of things we want to keep in mind, because even though we are borrowing a strategy that generally comes from tobacco control, sugary drinks are different from tobacco products in some important ways that are worth highlighting. First, unlike tobacco, which is deadly when used as directed, sugary drinks can be harmless when consumed only occasionally. If you drink a sugary drink while sitting next to someone in a restaurant, you don't expose them to a dangerous toxin. And lastly, the beverage industry is different from the tobacco industry in some key ways. For example, if you look at the tobacco industry, their product line is pretty uniform. All their products are tobacco products, they're all dangerous, and they're all subject to taxation. The beverage industry is quite different. If you want to look at Coca-Cola just as an example of one company, it certainly sells Coke and other sugary sodas, but it also sells Dasani water and Odwalla fruit juices. So as an industry, it sells a broader variety of products to a much broader market of consumers. So turning to the first of our questions, how do you increase price? There are two main ways: through sales taxes and excise taxes. And Ian has already given a great overview of those strategies and sort of the pros and cons of each as public health strategies. With respect to sales taxes, there are many states, and Washington included, that does already apply a sales tax to soft drinks. And in that sense really distinguish them from groceries. Groceries generally are tax exempt because we all need to eat. But here in Washington we do apply a sales tax to soft drinks out of a recognition that they're different. But the sales taxes that are applied are generally too small to have an impact on behavior. And they're also not applied until you get to the checkout aisle, as Ian mentioned. So they really are limited in their ability to impact consumer behavior. Excise taxes, by contrast, are included in the shelf price, so have the potential to affect consumer behavior. They also can be imposed really at any point in the chain of commerce. So they could be imposed on the manufacturer, the bottler, the wholesaler, or the retailer. And the revenue generated from excise taxes could be earmarked for things like obesity prevention programs. As has been mentioned earlier, there are a number of states and a couple localities that have proposed excise taxes over the past couple of years. So there really is a growing movement that's looking at this because of the promise that sugary drink excise taxes hold as an effective public health strategy. The two localities that probably got the closest in their efforts were Philadelphia and Washington, D.C., although their efforts did fall short in large part due to the very well-funded campaigns launched by the soda industry in opposition. So the last question that I'm going to address before turning things back to Jim is, how will price increases impact consumption? And Christine started by talking a little bit about price elasticities and how they range depending on the product you're looking at. So you'll have a different elasticity for a luxury yacht versus milk. Very recent research has shown that a 10% increase in the price of sugary drinks has the potential to reduce consumption by about 12%. So using that price elasticity, it's estimated that a tax of a penny per ounce, which would, for example, increase the price of a 20-ounce soda by about 20 cents, would prompt people to reduce their sugary drink consumption by about 24%. And of course, a higher tax, higher than a penny per ounce, would prompt greater reductions in consumption. Now, it's important to point out that these are just estimates, and as Ian said, that's because we don't really have an existing and meaningful excise tax out there to measure. And these estimates also assume that the price of the tax will be fully passed on to the consumer. So if the excise tax is imposed at the manufacturer level, that they will then pass it on to the wholesalers, down to the retailers, down to the consumers. And although it is a fair assumption that it will be passed down, because we have seen that in tobacco and alcohol, that those taxes generally have been passed down to the consumer, it does remain to be seen whether that will be the case with sugary drinks. As I noted earlier, the beverage industry is much broader than the tobacco industry and certainly has the capacity to spread a price increase over their whole product lines. So I'm going to turn back to Jim for a discussion about revenue.
So the question is, once you, let me skip a slide here. I'm sorry, I'm having a little Okay, so how to use the revenue. So once a tax has been imposed, the question becomes what is done with the money that it generates? And this is actually an important strategic question and political question to consider. Taxes on sugary drinks are pretty popular. Many polls now have been done in states and cities across the country showing that majorities support taxing sugary beverages. However, when you ask the question again in the poll, if the tax is dedicated to preventing childhood obesity, for example, then the percentage of support goes up by as much as 10, even 15% for the tax. Examples of ways it could be used for obesity prevention, including improve the quality of school meals by giving schools some extra money to buy healthier products, expanding recreational opportunities by increasing the hours or staffing or programming at city parks and rec programs, for example. How much money you actually raise depends on two factors. What's the volume of items that are going to be taxed, or the tax base, and then how high the tax will be. So some considerations when designing a tax might be, should you tax all sugary drinks or only soft drinks? I would make the case that it's very important to tax all sugary drinks because of the increasing market share and large amount of sugar in things like energy drinks and sports drinks. Higher taxes will be more likely to be passed on to consumers because the industry will be less able to absorb them, so that could argue for thinking of a penny an ounce or even 2 cents an ounce, as some other cities have done. In Washington State, for example, if you replaced a penny an ounce tax on sugary drinks, all sugary drinks, that would raise $191 million a year in Washington State, which is a lot of money and gets the attention of policymakers. However, it's a challenge to impose these taxes. In Washington State, the legislature did propose putting a tax on carbonated beverages. These actually included both regular and diet drinks, as well as some other candy and other kind of less healthy items. The tax was fairly low, so it wasn't really destined to and designed to decrease consumption. It was more of a revenue-generating proposition for a state, just like many states that were facing big deficits. And it wasn't earmarked for obesity prevention. It went into the general fund. However, once this tax was passed, industry reacted quickly and furiously and paid signature gatherers to put a referendum on the ballot, spending more than any other signature gathering campaign in the history of the state. And then once they got it on the ballot, spending more than $16 million to support the initiative to overturn the tax. That was more than ever spent on an initiative before in Washington State, and more than was spent on, for example, a state senatorial campaign for the U.S. Senate. They also engaged in advertising, which claimed that it would, or implied that the tax would raise the price on all grocery items, not just on those targeted by the tax. And with this massive outpouring plus anti-tax sentiment in the state, the initiative passed with a 60% vote statewide, so the legislature was overturned. I think what this does, it illustrates the power of industry and the importance of those who want to consider doing a tax to make sure that they have a effective political as well as revenue-based strategy to go ahead with their taxes. Doesn't mean it can't be done, obviously, and my prediction is that there will be a successful effort to pass a tax sometime in the next couple of years somewhere in the country, either state or locally, but that the proponents of such a tax need to be prepared to wage a significant political campaign to counter what will be a guaranteed industry opposition to such efforts. Some of the factors to consider when designing a tax are the following. The idea of putting a tax abstractly, an excise tax, for example, is simple. But as Ian explained, the concept is straightforward. However, when it gets down to the nuts and bolts of trying to figure out how to actually do it, it becomes more complex. Some of the questions that need to be considered is who's going to impose the tax? State government? Is it a city government? A county government? What type of drinks are taxed? As mentioned before, is it all sugary drinks? Will dairy products be included, such as chocolate milk, or excluded? So those kind of questions need to be discussed. What is the tax collection mechanism? How will actually the tax auditors and tax collectors go out in the field, figure out who should be paying it, figure out what drinks are on and not on the list so that the retailers know what to tax or not tax? There's a lot of details that need to be worked out. As mentioned before, how will the revenue be used? And then there's the whole political set of considerations. How do you build support both among decision makers and the public? And how do you counter the opposition using social media and community-based grassroots outreach, because we will never be able to outspend industry, for example, on in the paid media arena. So I'll just conclude here. Here are some resources that we found helpful. The Yale Rudd Center, the Center for Science of the Public Interest, and the California Center for Public Health Advocacy all have excellent sets of resources, fact sheets, sample media tools, videos, etc. We have some of our own work as well available on our website, and we'd be happy to talk with other sites if people are interested in hearing more about the ideas around how you actually implement such a tax at a state or a local level. So thank you very much.
Thanks, Jim and Ann. And I'm going to leave the slide up for just a second while we transition on over to my colleague Heather. But first, I just wanted to make a note that we have gotten a ton of questions, and we won't be able to answer all of them during our allotted time today. So I encourage you to definitely follow up with us afterwards if you don't get your question answered. We will try to reach out to those of you proactively, but if we don't get to you in time, definitely send us your question, and we'll get back to you as soon as we can. So now I'm going to turn it over to Heather Wooten. She will be turning us over to the healthy side and thinking about how to make those products cheaper. Heather?
Thanks, Christine. This is Heather Wooten. Hi, everybody. I am a Senior Planning and Policy Associate here at Public Health Law and Policy. So now that we've talked about ways to make unhealthy food less affordable and less accessible, let's talk about some strategies communities are using to make healthy food more affordable and accessible. And remember, as Christine mentioned earlier, affordability doesn't just come from the price of the apple on the shelf. There are a lot of factors at play, including how much it costs for someone to even get to the store, whether or not a grocer or farmer's market accepts food stamps, which are now called SNAP, as well as those systemic issues like whether or not a corner store owner can get the right amount of produce at the right price. First, let's take a look at grocery stores. Grocery stores tend to offer I'll go back one here. Grocery stores tend to offer the broadest selection of food at the most reasonable prices. Yet not all communities have access to a grocery store. And in some places, grocery stores located in low-income communities actually charge higher prices and offer lower quality goods. So what are some of these policy strategies that communities are using to attract and improve grocery stores? First off, we have fresh food financing type initiatives. Essentially, the idea is to create a pool of incentive funding available to grocers who locate specifically within underserved neighborhoods. And we've seen examples of these at the state and local level, and now at the federal level with the Healthy Food Financing Initiative. Definitely something any of you should check out who are on the phone today. Local governments also administer many different kinds of tax incentives for which supermarket developers would be eligible. Some of these, such as empowerment zone tax credits, are specific to particular geographic areas. Christine also mentioned zoning as an incentive for attracting grocery stores to underserved areas, and specifically she mentioned New York City's FRESH initiative, which is the Food Retail Expansion to Support Health program. And that initiative offers density bonuses, a powerful incentive for developers to locate in underserved neighborhoods and include fresh food retail as part of their development. Assistance with locating good development sites can also be another effective strategy, and the City of Chicago's Retail Initiative is a good example of that. They do targeted outreach to supermarket developers to identify available parcels. And last but not least, you'll see something that I think is less frequently discussed when we talk about affordability and access to grocery stores, but I think it's critical, and that is workforce development and local hire policies, which can augment the impact of attracting a grocery store to an underserved community. At the end of the day, families will be better able to afford healthy food if they have a living wage job close to home, and combining grocery attraction with workforce development can help make that happen in communities. Next, let's take a look at corner stores. Corner stores can be found in urban and rural communities around the country. We really mean small stores that don't really have enough of a floor space or really enough of a product mix to meet the definition of a full-service grocery store. In many cases, these stores have less than healthy offerings. Tobacco, junk food, and liquor are often easier to find on their shelves than healthy food, and they don't always accept federal food assistance like SNAP and WIC. In the worst cases, small neighborhood stores are nuisance or blight, selling drug paraphernalia, encouraging loitering, and eroding feelings of safety. However, small stores can also be a community asset. Existing business owners often feel a real stake in the community, which is not always the case with outside operators. And they may be the only source of food in low-income communities, healthy or otherwise. So communities are trying a number of creative strategies aimed specifically at corner stores to encourage them to sell healthier, more affordable food. Cooperative purchasing is one great example. Corner stores and small rural grocers often can't meet distributors' minimum order requirements. To overcome this kind of barrier, a number of small stores in Kansas have banded together in an informal collaboration through which they make collective orders to a single distributor. The distributor delivers to one of the stores that in turn uses its own small refrigerated truck to make deliveries to the others. Business planning can also improve financial sustainability when stores shift to offering healthier products. San Francisco's Good Neighbor Initiative requires store owners to agree to stock more fresh produce and reduce the amount of tobacco and alcohol advertising in their stores. In exchange, the San Francisco Redevelopment Agency hired a grocery industry expert to assist the owners with business planning. And we actually have a great podcast describing this program on our website, which is www.healthyplanning.org. Getting healthy, affordable food in communities isn't just a matter of grocery stores and small stores. Americans eat an increasing percentage of their meals away from home, and a lot of this is fast food or convenience foods. In fact, we eat about 19% of our meals statistically in cars. That means that many communities are looking at getting healthier, more affordable foods in restaurants as well. So one of the strategies is technically a strategy to reduce access to unhealthy food, but I'm talking about it in this section as well because I think it's a really important one, and that's the idea of creating a healthy food zone. Zoning has been used to restrict fast food and chain restaurants in communities across the country, but mostly for non-health reasons, such as aesthetic concerns or wanting to support local businesses and local entrepreneurs, and also concerns about traffic and safety. Los Angeles made news when they passed a policy prohibiting new standalone fast food in specific neighborhoods explicitly for health reasons. Public Health Law and Policy has created a model policy to create healthy food zones near child-sensitive uses, especially schools, which is available on our website. A number of localities are also developing healthy menu certification programs to recognize that the restaurants that do offer healthy choices. These certification programs can be used as an incentive to increase healthy food offerings in restaurants. And we should have a healthy restaurant certification toolkit on our website soon. Farmers markets can also be a very important strategy for increasing access to farm fresh produce in underserved communities. However, there are often a number of barriers to farmers markets which can make them less accessible and can increase the price of doing business for farmers and farmers market managers. For example, many advocates don't think about how zoning and planning policies can actually create barriers to locating and opening farmers markets. By zoning for farmers markets as a defined and allowable use, you can remove barriers to markets locating in underserved areas, help them optimize their market location, and increase access for low-income consumers. Zoning provisions can also require farmers markets to accept various forms of food assistance. In San Francisco, for example, farmers market vendors are required to accept coupons, vouchers, and EBT cards. Those are the electronic benefit transfer cards for SNAP. Revisions to the WIC food package in 2007 gave states the choice of whether to accept WIC vouchers at farmers markets. This would be in addition to and separate from the Farmers Market Nutrition Program, which is a small seasonal program in 45 states. So thinking creatively about how your land use policies can either incentivize or require markets to accept EBT and SNAP is a great way to make those markets more affordable and more accessible to the low-income members of your community. And PHLP has a set of model policies for including farmers markets in both comprehensive plans and zoning ordinances that are also available on our website. Urban agriculture, which I'm using here as an umbrella term for community gardens, urban farms, market gardens, and other kinds of urban food production, also offers the opportunity for low-income families to grow their own and, in some instances, to sell the fruits of their labor. So when we talk about thinking about policy strategies for urban agriculture, these will sound very familiar to farmers markets. We're talking about ensuring that community gardens, urban farms, and other urban agriculture uses are defined allowed uses in zoning code. And that includes thinking about locations on public and private land. Both have their own land access and tenure challenges. The other thing that I think is really important is to think about how we can support entrepreneurial urban agriculture and to consider including provisions for community gardens, urban farms, and market gardens that are specifically designed to allow members to grow food for sale. This is a way, again, to sort of get more bang for your buck out of a food access strategy. You're increasing someone's income while also improving access to healthy food. And of course, there are ways that cities can actually subsidize the cost of urban agriculture to make that a more affordable option for people, such as offering publicly owned land to community gardens and urban farms and effectively subsidizing the cost of that land, and also subsidizing the cost of water. So I have mentioned a number of resources over the course of this little segment here, and I just want to point you to a few of the ones that I think might be particularly of interest to all of you. So we have fact sheets on creating a healthy food zone around schools and establishing land use protections for community gardens. You can download all of these, including the great toolkits here on attracting grocery stores and using the new WIC food packages as a leverage tool to basically improve the affordability and accessibility of healthy food in neighborhoods on our website, which is, again, you can get to us either through the healthyplanning.org website or through phlpnet.org. And one strategy that I didn't talk explicitly about, but that we heard Christine and Ian mention at the beginning of the webinar, is procurement. And our next guest, Melissa Watford, is going to tell us about her experience working with a hospital to make healthy food more accessible and affordable. And we also have a new primer on government procurement that explains how the power of the purse can be used to create healthier communities. And with that, I will turn it over to Melissa.
Thanks, Heather. Okay, so I work for a hospital system. We're located in the central part of North Carolina. We're a private, not-for-profit hospital system. We serve about 15 counties. Within our system, we have 3 major hospitals. And talk to you a little bit about what we've done to reduce the price of healthy foods and increase the price of unhealthy foods. First off, we had some experience with policy environmental change through our work with tobacco. We were the first hospital system in North Carolina to adopt a tobacco-free policy. Our CEO and the board got on board and put forward the charge for us to really look at healthy foods and what we could do around healthy eating and physical activity. So our First Fit Wellness Committee was established. That was back in 2008. One of the first things we did is we started an on-campus farmers market to provide access for employees for healthier foods. The farmers market attracts about 725 people each week. About half of those are employees. And we've seen some great results as far as having the access to the healthy foods on campus. One of the interesting things with the farmers market, they currently accept WIC, and starting next month we'll be accepting SNAP and EBT payments at the market. After starting the farmers market, we focused on the vending initiative, and that was really our first experience with looking at reducing the price of healthy foods and increasing unhealthy selections with the vending. We started with about 50% of our vending options, changing that to healthy vending, creating a labeling system for what the healthy foods were, and we actively monitored purchase changes. We're now at 75% of our vending policy or vending items being healthy. So, oops, I skipped over a slide here. So the changes we saw in vending, you can see that water, diet drinks increased, other beverages decreased, other sugar-sweetened beverages decreased. Our First Fit snacks, which were the healthier selections, increased, and then other snacks decreased. And we continue to monitor that and increase the healthy options. After experiencing the vending thing, we realized to really make an impact and difference in the hospital, we had to look at what we were serving in the cafeteria. And the goal was to impact customer choices through pricing, increasing the price of unhealthy food and decreasing the price of healthy food. We put together a committee of folks, including the food service company that our hospital works with, Sodexo, registered dietitians. We had community health services and employees together to look at what we needed to do to make this happen. Initially, there were some perceived barriers. We thought that we'd have pushback from customers. Sodexo was concerned about the cost to implement, that they would be losing revenue. And then we also faced the challenge of how we were going to communicate this. The first barrier did not come to fruition. The customer feedback we got was very positive. To address the cost to implementation, First Health agreed to make up any decrease in revenue caused by this change to Sodexo for making the changes. That fortunately also did not happen. Revenue actually increased. And then we put together a communications plan to communicate with customers. So to get started, we collected data on current usage and pricing. We developed a new pricing strategy, and we developed a communications plan to kind of communicate this to our employees. So as you can see, we had flyers. We put it on our intranet. We put it on the bulletin board. We did lunch and learn series. We did product tasting, and it launched October 15th of 2008. So in addition to pricing strategies, we also did some other things. We made product placement changes in the cafeteria so that the healthy items were more prominent, easy to access. We added some things to the menu that weren't there. We did remove a few things such as donuts, and we also looked at portion sizes on the current selections that we had and implemented some portion control in addition to the pricing strategies. So this just shows you the results after the first year of implementation, what we saw. So changes at breakfast, you see that oatmeal, apples, oranges, bananas, all of those increased, and some of the unhealthy products that were sold during breakfast decreased. We found the same thing with grill items, however, at a much larger scale. You can see the reduction in some of the unhealthy items at the grill, but also turkey burgers and veggie burgers increased dramatically the purchase of those types of things. The salad bar and entree items, you can also see the increases. The salad bar was a huge increase, as well as some of the other healthy items that we sold now. And then beverages, increase in water and milk, decrease in regular fountain drinks, energy drinks decreased too, and regular soda. So I'm just going to show you some price comparisons that we think influenced this before and after. So entrees before were $2.10. They are subsidized for employees. The healthy entrees were decreased to $1.75. Unhealthy were increased to $2.50. You can see the changes in the soda. The diet sodas were $1. The regular sodas were $1.50. And what's not on here is water is actually 80 cents. So water is your least expensive option. And then it goes through some other items. Huge change was the salad bar. It was, before we did the pricing strategy, it was $4.50, and then it was decreased to $2.50. And you can see down the bottom where we used to sell 24,000 ounces of salad, and it's now well above the 71,000. The other thing that changed is just the amount of folks that are using the cafeteria and the amount of purchasers. In 2009, you can see we had about 1,650 encounters per day, and in 2011 that had grown to over 2,000. overall, the impact on revenue, the grill revenue increased. Salad and deli revenue actually decreased, in large part due to the fact that we make the salad bar very inexpensive. However, the revenue is made up with the other areas like the entree, the grill, the breakfast, and beverage revenue. So year-to-date, revenue tracked items increased. So it did not affect revenue. So just in summary, this was a pilot project. We are still improving, making improvements, looking at bringing in more local foods, and experimenting with some pricing and some even healthier options. But it did obviously increase or change behavior within our hospital, and it was a good learning experience that we've been able to share. We're working with North Carolina Prevention Partners as a healthy hospital, and a lot of the criteria that we used is available on their website, ncpreventionpartners.org, and you can see what other hospitals in the state are doing around this similar initiative. And that is it.
Great. Thank you, Melissa. And you got a ton of questions, but we don't have a whole lot of time to take all of them. So I'm going to start with one for you, and then I'm going to send a question on over to the folks in Seattle after that. So the question that I thought was interesting for you is, can you talk a little bit about the implementation costs of this program in terms of what kinds of staff you needed to get involved, and if you saw any other implementation costs?
Okay. It was basically a committee of hospital employees that got together as a task force that did it on our own work time. As far as implementation costs, I don't think they were very much. The food was sort of already available. It was just pricing it differently, setting up some different product placements. I can find out from the food services director anything more specific, but I don't think there was a large cost to that.
All right, thank you. And then a question going back to the sugar-sweetened beverage tax strategy. Ann or Jim, from the different proposals that you've seen, do sugary drinks include the coffee drinks and smoothies that are sold at, say, Starbucks? You guys are from Seattle, so this is a very appropriate question. And other types of cafes.
Ann, do you want to take that one? Or do you want me to do it? Go for it.
Go ahead.
So essentially what the sugary SSB or sugary drinks taxes generally refer to bottled products, so not products that you get like a milkshake or a fresh-made drink at a coffee place. So it would, though, apply to sugary coffee drinks, for example, that are in the bottles like the Starbucks Frappuccino kind of things. But again, those would be decisions that are made locally at the state or local level and might vary from jurisdiction to jurisdiction depending on individual choice and preference.
And I would just add to that Jim is totally right that most of the proposals deal with bottled sodas, but you could also apply a tax to the syrups that are used to make fountain drinks and the drinks that are made for you at something like a Starbucks. So the jurisdiction would have a choice about whether or not to also apply the tax to a syrup in those instances.
Thanks. All right, and then one last question, and then we will wrap up. This one is for Heather. There was a question about how do you incentivize farmers and producers to participate in a farmer's market with EBT and WIC access?
Well, that's a great question, and I think there's a policy answer to that and a non-policy answer or a programmatic answer. Just to start with the programmatic answer first, I know in a number of places where the acceptance rate of EBT and WIC by farmers markets has been higher, there's been a lot of effort put out there by either cooperative extension, community-based organizations, or other community resources that have links or ties to farmers market communities to help provide technical assistance on accepting EBT and WIC and to offer support and basically guidance best practices, manuals, that kind of thing. And I think that that's a really critical way to help make it easier for farmers markets to accept EBT and WIC, because these programs do require some specialized equipment. They do require some special systems to be set up, and that can be a challenge. So lowering that barrier to entry, either something directly that a government agency can offer or something that a community-based partner can offer, I think is really important. In terms of policy types of incentives, I talked about a requirement to accept EBT and WIC through zoning. And, I have to say I find it to be kind of an important issue to consider that all farmers markets are accessible to all members of the community, although I understand that there are some actual real challenges to accepting those programs. And so I don't think that requirement should come without some form of assistance or help. If you're talking about creating an incentive program, what you could think about are many communities require markets to get permits. Sometimes they're special event permits. Sometimes they're permits that are specifically set up to be for a farmer's market. You could offer a cheaper permit or some kind of reduced permit fee to farmers markets that accept EBT and WIC. I think that's a great way to expend public resources to improve access and to promote the public good. The other idea would be is if you're looking at zoning specifically, you could structure your zoning ordinance such that markets that accept EBT or WIC either get preferential locations in communities like a park, central locations, or you could use, again, the sort of conditional use process that sometimes communities use for zoning things like farmers markets to have markets that don't accept EBT or WIC be conditional, and that's basically a way of increasing kind of the cost and hassle of getting your land use permits together for your project.
Thanks, Heather. So we have gone around the world of food policy in about 75 minutes, and I'm tired now, and I'm sure you guys have just have a lot of inspiration and ideas to think about now once the webinar ends. A few reminders. Please, don't hesitate to get in touch with us, or the presenters have provided their contact information after the webinar if you didn't get your question answered. And we will be posting slides and a recording of this webinar on our website by tomorrow, and you'll get an email about that in your inbox shortly of how to get to that website. We will not be having our July webinar, so if you've signed up for that one, it's canceled, and if you haven't already, you'll be getting a cancellation notice on that. Stay tuned for an announcement about a possible fall webinar schedule, so keep an eye on our website and in your inbox for that. And finally, thank you to all of our presenters. This has been a really engaging and fascinating webinar. It's covered a lot of topics, and we're really happy to have you join us. So thank you all for joining, and we'll talk to you soon.